बिस्मिल्लाह कीजिए।
बिस्मिल्लाहिर्रहमानिर्रहीम। कुल हुवल्लाहु अहद अल्लाहु समद लम यलिद वलम यूलद वलम यकुल लहू कुफुवन अहद ज़ालिक अल्लाहु रब्बी। मैं इस वेबिनार में प्रोफेसर मीर जलालुद्दीन साहब, प्रोफेसर ऑफ मेडिसिन, वुमेन मेडिकल कॉलेज, विजिटिंग फिजिशियन, BHQ हॉस्पिटल एबटाबाद। ही इज़ हाईली क्वालिफाइड। इन्होंने कई से मेरे ख्याल है MBBS किया है, शायद मेरे स्टूडेंट भी हों। फिर FCPS भी इन्होंने मेडिसिन में किया, CHP किया मेरे ख्याल है, और इसके बाद डिप्लोमा किया UK कार्डियोलॉजी में। और माशाल्लाह आप इतने पढ़े लिखे हैं और टाइम दिया आपने, संडे का टाइम। SPM में वेबिनार के हमारे बहुत ज़्यादा कोलैबोरेटर्स हैं। और मैं ओवर टू यू, बगैर वक्त ज़ाय किए, मैं प्रोफेसर मीर जलालुद्दीन साहब आपको माइक हवाले करता हूं ताकि आप अपने प्रोग्राम के बारे में बताएं। वेरी वेरी इंपॉर्टेंट टॉपिक बिफोर स्टार्टिंग द रमज़ान, डायबिटीज़ एंड रमज़ान। थैंक यू सो मच। ओवर टू यू प्रोफेसर मीर जलालुद्दीन।
Uh, Thank you very much, sir. Bismillah Rahman Rahim. It is a great honor for me to talk on this August forum. And thank you very much, Madam Salma, to invite me to talk in front of very giant figures of medicine. Today we'll be talking about diabetes in Ramzan. Diabetes is a very big challenge for the diabetic patients who are fasting and the healthcare professions as well who are managing diabetes on day-to-day basis. For the next 35 to 40 minutes, we'll be talking about diabetes in Ramzan. The worldwide prevalence of diabetes is increasing, and the patients who are fasting with diabetes is also increasing day by day. Prevalence-wise, Pakistan stands, according to the number of the patients, Pakistan stands on number 3. And according to the prevalence of patients, Pakistan is now number 1 in the world. So there was a need for effective guidelines for the management of diabetes during Ramzan, and these guidelines were released in 2021 by International Diabetes Federation. There was a dearth of evidence-based medicine, but now as the guidelines are increased, the management of diabetes in Ramzan has become a bit easier. So Ramzan is, as we all know, that it is one of the 5 pillars of Islam. It is a holy month for Muslims. It lasts for either 29 or 30 days. The duration of fast varies according to the geographic location in our country. Nowadays, I think it will be of 12 hours. And the participation and rewards for good deeds are highest during Ramzan. And according to the Holy Quran, whoever witnesses the month of Ramzan, she should fast. But if any of you is ill or traveling, then that person is exempted from fasting, and the missed fast should be completed at another time. The exempted categories include children, the sick, the travelers, women during menses, and anyone with reduced mental capacity. Pregnant and breastfeeding women have the right not to fast regardless of whether they have diabetes or not. Some of the individuals with diabetes can be exempted from fasting, but majority of the diabetic patients, if they are well controlled on their drugs and diet, they can continue with fasting. Diabetes, as it is metabolic in nature, any major changes in diet and food intake leads to increased risk of complications, such as these complications are hypoglycemia or hyperglycemia as well, and dehydration, and sometimes acute metabolic complications of diabetes, such as diabetic ketoacidosis and hyperosmolar or hyperosmotic state. Despite the exemption, many people they decide to fast during the Ramzan. In such cases, diabetes may help in strengthening the bond between the healthcare professional and the diabetic patient. It may also provide an opportunity to improve diabetes management with a focus on self-care and medical regulation and mealtime. This was a big study, the EPIDIA study, and it includes the knowledge, practices, and attitudes of diabetic patients. It revealed that only 67% of the patients with type 1 diabetes and 37% with type 2 diabetes were self-monitoring their blood glucose levels. Rest of the patients, they do not monitor their level. 42% of the patients with type 1 diabetes and 78% of the people with type 2 diabetes fasted for at least 15 days during Ramzan. Half of the study population did not change their lifestyle during Ramzan. Medical advice was provided to 68% of the people with type 1 diabetes and 62% of the people with type 2 diabetes. And the majority of these people did not change their medication dose during Ramzan. The number of hypoglycemic and hyperglycemic episodes were significantly higher during Ramzan in people with type 2 diabetes. This is something about the physiology of Ramzan fasting. Ramzan marks a sudden shift in meal times, sleep, and wakefulness patterns, leading to physiological changes in the homeostatic and endocrine processes. Ramzan leads to changes in sleeping patterns and circadian rhythms. The body weight typically decreases in Ramadan, but in our population, it is seen that it sometimes increases as well after the Ramadan. In a healthy individual, fasting causes the release of glucose from glycogen stores, which is called glycogenolysis, and the formation of glucose from non-carbohydrate substrates, which is called gluconeogenesis. Ramzan fasting is associated with favorable effects on lipid profiles in healthy individuals. So, without suitable management, individuals with diabetes are more likely to experience severe hypoglycemia during Ramzan than in non-fasting periods. Fasting can lead to metabolic changes and changes in clinical measurements such as blood pressure and body mass index, and might help with fatty liver disease as well. So, fasting can have positive effects such as improving compassion, empathy, and social interactions. Fasting during Ramadan can lead to greater spirituality and mental well being and bring both positive and negative psychosocial outcomes to the feeling of stress and depression and mood swings. The lifestyle changes that accompany Ramadan, such as eating times, diet, physical activity patterns, and sleeping schedules, can have different effects on mental and physical well being. So, Ramadan fasting can have a positive effect on mental well being of the individuals as well. So this is a very direct need for risk stratification of the patients because we have to classify the patients on the basis of their patterns in Ramadan and specific risks so that we can advise them whether to fast or not. So Muslims with diabetes who fast, they face certain challenges such as there is a change in regular diet, physical activity, and medication schedules, which can disturb the metabolic activities. The risk which is associated with fasting are uh, diabetic ketoacidosis, hypoglycemia, hyperglycemia, dehydration, and thrombosis. Although the major risk of hypoglycemia and hyperglycemia affect patients with diabetes on a daily basis, fasting may increase the risk of these events. Individuals who decide to fast against the advice provided by their healthcare professionals should follow expert and detailed guidance to avoid the development of serious complications. So more than 100 people with diabetes, they fast during Ramadan, and this number is bound to increase day by day. The safety of diabetic patients during fasting is very important, and these factors should be considered when quantifying the risk for certain such individuals. These include the type of diabetes, medications, individual hypoglycemic risk, presence of complications and comorbidities, individual social and work circumstances, previous Ramzan experience. This assessment exercise must be individualized for every single patient to fast during Ramadan, and personalized care must be provided accordingly. Um, so the healthcare professionals, they need to consider a range of risk factors to stratify the patients in certain risk, and these risk factors are either Ramzan related, like the length of fasting hours. This is 12 hours. This will be about 12 hours in nowadays. And then session of season of fasting, uh, weather in which the Ramzan is occurring, the geographic location of the patient where he's living, the social changes, past experience of diabetes, whether the previous Ramzan was okay or the patient has to omit certain fasting hours. And then diabetes related risk factors like type of diabetes, the duration of diabetes, complications, which drugs is he using, whether the control was good previously or not, hypoglycemia risk of the patient, whether he's aware of his hypoglycemic episodes or not, excess of care, and then the factors considering concerning the individuals like age of the patients, gender, occupation, pregnancy status, whether she's lactating or not, the meal patterns of the patient, exercise nature and timing, motivation of the patients, and personal preferences. So this is the these are the factors in which, on the basis of which, we stratify the patients in certain risk categories. We have to score each individual on the basis of these categories. Like the patient, if he's having type 1 diabetes, the score is 1. If type 2, the score is 0. Similarly, on the basis of the presence of like for example, the presence of hypoglycemia, if the patient is unaware of his hypoglycemic episodes, the risk is the points are 6.5. And if the patient has got an episode of recent severe hypoglycemia, the points are 5.5. Or if there is no hypoglycemia, the points are 0. Similarly, the level of hypoglycemic control on the basis of HbA1c, the type of treatment which he is getting. For example, if the patient is on insulins, the risk is higher. If the patient is on oral hypoglycemics, the risk is lower. With sulfonylurea, risk is a bit higher than as compared to the other hypoglycemics. If the patient is monitoring his blood glucose regularly, the risk is low, and if he is not monitoring, the risk is high. And according to the basis of acute complications, if the patient has an episode of DKA or hyperosmolar episode, the risk is high. And if he has not had this episode previously, the risk is low. Similarly, the macrovascular complications, if the patient is having unstable ischemic heart disease, the points are 6.5. These points are added at the end, and the patient is stratified on the basis of these points. Pregnant patients have got higher scores as compared to non-pregnant patients. Frail patients have got higher scores. If the patient is doing an activity which involves highly intense physical labor, the score is higher. How about the previous Ramzan experience? The previous experience was good or not, and the fasting hours are more than 16 hours or less than 16 hours. So this score is added for each individual, and the patient is categorized on the basis of this score in low risk category or moderate risk category or high risk category. So the resulting score will determine the overall risk level for an individual with diabetes that is seeking to fast during Ramadan. If the patient is in low risk category, which is 0 to 3 points, the fasting is safe and fasting is obligatory. The patient should be advised to fast if the score is between 0 to 3. Medical evaluation is done, medication adjustment is done, and strict monitoring of blood glucose is very important. If the patient is in moderate risk, the score is 3.5 to 6. Fasting is safe in these patients. Uh, but the patient choice is also given weightage. If the patient may choose not to fast if they're concerned about their health uh, after consulting the doctor and taking into account the full medical circumstances uh, and patient's own previous experiences. The patient can choose not to fast, but fasting is probably safe in this group. And this high risk patients where the score is more than 6, fasting is probably unsafe. The patient is advised not to fast. So this is the risk category. Risk stratification is very important, and this should be done before starting of Ramzan. The studies have suggested that people with type 1 diabetes may fast if they are stable, they are healthy, they have good hypoglycemic awareness, and comply with their individualized management plan under medical supervision. Strategies for safe fasting for individuals with type 1 diabetes include Ramzan focused medical education, pre Ramzan medical assessment, including robust assessment of hypoglycemia awareness, following a healthy diet and physical activity pattern. Um, Modification of insulin regime is done, and frequent self monitoring of blood glucose levels or continuous glucose monitoring is encouraged in these patients. If the patients are in geriatric population, old age patients, uh, the combined with ill health is considered as very high risk for fasting. In such cases, functional capacity and cognition need to be assessed, and care provided should be adapted accordingly. As hyperglycemia is associated with increased risk for both mother and baby, pregnant women with pre-existing diabetes or gestation diabetes are advised not to fast. So the pre-Ramzan education to the patients and healthcare professionals and a specific nutrition plan should be given to the patients so that they uh, can keep their fast safely. Structured diabetes education provides knowledge to the people with diabetes regarding the effective self-management of their condition. Ramzan-focused diabetes education should be targeted to the people with diabetes, to healthcare professionals and general public. So people with diabetes should be educated about glycemic control, maintenance, lifestyle modification, and risk minimization. Healthcare professionals should deliver advice in a culturally sensitive manner, encourage communication, improve the individual doctor relationship, and provide overall care. So, and the general public should be provided with medical advice and religious regulations about fasting during Ramadan. So, pre Ramzan education is crucial for safe fasting during Ramadan. More evidence has emerged supporting the use of pre Ramzan education to achieve safe fasting during the Ramadan. Pre-Ramzan assessment needs to take place ideally 6 to 8 weeks before the start of Ramzan. So healthcare professional will be able to obtain a detailed medical history and perform a risk assessment. Risk assessment will form the basis of all medical recommendations thereafter. So and treatment adjustments, the provision of Ramzan-focused education and nutrition advice. It also emphasizes on different when to break the fast, when to exercise, fluid and meal planning, and medication adjustment during fasting is very important. So these are the key components of a Ramzan focused education program. SMPGs help people with diabetes in effective self-management. Moderate exercise during fasting hours is acceptable. In Ramadan, the Tarawih prayers is also considered a full exercise for the day, and the treatment regime may require modifications during Ramadan to reduce the risk of at 7 times a day. So the 7 times are pre-Sehri, in the morning time after 2 hours after the Sehri, in the midday around the Zohr prayers, mid-afternoon after Asr prayers, just before Aftari, 2 hours after Aftari, and at any time of the day when the patient is feeling the symptoms of hypoglycemia or the patient is feeling unwell. So having the skills to self-monitor blood glucose levels can empower people with diabetes to effectively self-manage their disease. Dietary advice for individuals during Ramzan is shown. The fasting and feasting nature of Ramzan can encourage the consumption of large carbohydrate, heavy meals, and sugary drinks, and treats that can impact blood glucose levels, potentially increasing the risk of complication in patients with diabetes. Providing dietary advice and meal planning can help people with diabetes to follow a healthy, balanced diet during Ramzan, reducing the likelihood of these complications. So the daily calories should be divided between Suhoor and Iftar. And after Iftar, the patients can take 1 to 2
मैंने दी
snacks.
तस्वीरें भेजूंगा आपको मैं तस्वीर देता हूँ आपको
Uh,
इसकी जो है
Meals should be well balanced. 45 to 50% of the meals should consist of carbohydrates, percent proteins, and less than 35% should consist of fats, and fat be more type. Uh, the low glycemic index diet should be included in the meals. High fiber foods that release energy slowly before and after fasting. For example, grain-free breads, beans, brown rice. Include plenty of vegetables and salads. Minimize foods that are high in saturated fats. For example, ghee, samosas, pakoras should be avoided. Sugary desserts should be avoided. Small amounts of oil can be used, olive oil and uh, The patients should keep themselves hydrated between the sunsets and sunrise by drinking water and other non-sweetened beverages. Caffeinated drinks should be avoided in the patients who are fasting. So the common practice of ingesting large amount of carbohydrate and fat-rich food at the sunset meal, and that is iftari, should be discouraged. And sehri should contain complex carbohydrates that will delay the digestion and absorption. Fluids should be taken liberally during non-fasting hours. So this is very important when the patients should fast. So all patients should break their fast if the blood glucose level at any time of the day, if it is less than 70 milligrams per deciliter, they should break their fast. And if the blood sugar comes out to be between 70 to 90, they should recheck their blood glucose level after 1 hour. And if it is less than 70, they should break their fast. If it's more than 70, they can continue with their rosa. Um, if the blood glucose level is more than 300 milligrams per dl, the patient should be individualized. Uh, the condition of the patient should be checked, and they can break their fast if the symptoms of hyperglycemia is occurring. Symptoms of hyperglycemia or hypoglycemia or dehydration or any acute illness, if it occurs during the fast, the patients should break their fast. So the sugars, if the sugar level is less than 70 or it is more than 300, we have seen that if the sugar levels are more than 300, the patients are generally, they go well, they are, and they are well if they're not any symptoms of hyper or hypoglycemia. They can continue with it. Time of the trembling, sweating chills, uh, steams, frequent foot must. Uh, there is a health issues can arise due to improper eating habits and reduced physical activity. So these are the unhealthy, like very large meals, more than 1500 calories, large of high protein patterns. These are unhealthy for glycemia or hypoglycemia or dehydration. Sun is a very good weight if the patients are uh, overweight. It's a good opportunity to lose weight. The weight loss may significantly improve glycemic control and may reduce cardiovascular risk as well. So, if the patients want to maintain their weight or they want to reduce their weight, they can calculate and post iftar meal, the total proportion of calories should be about 40 to 50% if they're taking. So this is a Ramzan nutrition plate. We can advise the patients as an example, like 1 cup of vegetables, 4 ounces of lean proteins, and half a spoon of oil, and 1 glass of low-fat milk. They can take dates, a handful of fruit. So this Ramzan plate, Ramzan nutrition implement medical nutrition people, the people with diabetes during nutrition, hypertension, and dyslipidemia reduction as well. So people with diabetes who are fasting consume an adequate amount of calories with balanced proportion of micronutrients included during the non-fasting period, that is sunset to dawn, to prevent hypoglycemia during the fasting period. Ramzan nutrition plan can help to plan a daily caloric target that may aid healthy weight maintenance by losing or gaining weight. It provides example of meal plans within the target calorie needs designed for use in different countries. Individual diabetes equally distribute their carbohydrate intake among meals to minimize postprandial hyperglycemia. This is the mobile-based application which can be used by the healthcare professionals and the patients as well to plan their nutrition accordingly. And these are the 10 principles of Ramzan nutrition plan. The adequate amount of calories should be divided between sahris and iftaris, and if necessary, 1 to 2 snacks after the iftar. Meals should be balanced with 45 to 50% carbohydrates, 20 to 30% proteins, and less than 35% fats. Meals can be designed according to the Ramzan plate model. Sugary heavy desserts should be avoided. Low glycemic index, high fiber carbohydrates are preferable. Hydration should be maintained between meals by drinking water and non-sweetened beverages. Sahri should be taken as late as possible, and adequate protein and fats should be consumed at Sahri to induce satiety. Iftar should begin with water to rehydrate and 1 to 2 dates to raise blood glucose. And low-calorie snacks such as fruit, nuts, or vegetables may be consumed between the meals. So this was about the nutrition which we have to plan during the Ramzan. And now the very important thing, which is the drug management during Ramzan. So the patients who are taking metformin during the Ramzan, if they are taking once daily dose of metformin, no modification of dose is required, but the metformin dose, if he's taking in the morning, should be shifted to to after iftari. If the patient is taking twice daily metformin, this twice daily metformin should be kept in Ramzan as well. Take one dose at the sehri and other dose after the iftari. If the patient is taking 3 times a day of metformin, the afternoon dose should be omitted and should be taken to after iftari. So the patient will be taking the afternoon and iftari dose, afternoon and the evening dose to the iftari, and the morning dose should be kept as it was before Ramzan. If the patient is taking prolonged release form of metformin, the prolonged release form of metformin should be shifted after the iftari. The risk of hypoglycemia is low in the patients treated with metformin, DPP-4 inhibitors, which are sitagliptin and vildagliptin. TZDs have also got a very low hypoglycemic index, which is pioglitazone, acarbose, SGLT2 inhibitors, which most of the patients are taking nowadays, which is empagliflozin and dapagliflozin, and GLP receptor agonist. The hypoglycemia risk is very low in by these drugs. So these drugs do not require dose adjustment during Ramzan. As long as GLP-1 receptor agonists have been appropriately dose titrated prior to Ramzan 6 weeks before, no dose adjustment or treatment modification is required. So the dose is not changed. The GLP-1 receptor agonist, we change the dose every month. So before the 6 weeks before Ramzan, the dose is kept fixed, and the dose is not modified during the Ramzan as well. So GLP-1 should be continuous as the patient is taking before Ramzan. SGLT2 inhibitors, which is dapagliflozin and empagliflozin, and they should be initiated at least 2 weeks to 1 month prior to Ramzan. So the SGLT2 inhibitors, ideally, they should not be started in a new patient before 1 month of Ramazan, of starting the Ramazan. So if the patients are previously on SGLT2 inhibitors, they should be taking SGLT2 inhibitors after the evening meal, which is iftari. The SGLT2 inhibitors should not be taken with sahri. So SGLT2 inhibitors also, they do not require dose adjustment or modification during Ramadan. Sulfonylureas have got the highest hypoglycemic risk along with insulin. So if the patient is taking a sulfonylurea in the morning, the dose should be taken at iftar. And if the patient is very well controlled, has very well controlled blood glucose levels, the dose of sulfonylurea can be reduced in the iftari. But if the patient has not very well controlled blood glucose levels, the dose should be kept the same.
Sorry, there was interruption.
Can I start again?
Yes, you can start.
So we were talking about sulfonylureas. Sulfonylureas have the highest risk of hypoglycemia. So if the patient is taking once daily dose of sulfonylurea, the dose and the patient and the blood glucose level is well controlled, the sulfonylurea is shifted to the shifted with iftari, and the dose can be reduced if the patient has got very well controlled blood glucose level. And if the blood glucose levels are not very well controlled, the sulfonylurea doses can be reduced as well in the iftari. If the patient is taking twice daily doses of sulfonylureas, uh, the morning dose should be reduced or it can be omitted as well, and the evening dose is kept uh, as same as before and should be taken before the iftari. Um, Older drugs in the class of sulfonylureas like lepincolamide, these have highest risk of hypoglycemias, and these older drugs should be avoided. But the second generation sulfonylureas like glimepiride and the more safer option, which is gliclazide, should be used in preference. So the risk of hypoglycemia in those treated with gliclazide MR seems to be low, as shown in a recent study, which is the Ramzan study, while sustaining good glycemic control. The gliclazide is a more safer option as compared to the glimepiride and other sulfonylureas in the group. So while managing the insulins, if the patient is on long or intermediate acting insulin, if the patient is taking NPH or detamir or glargine or degludec once daily, the dose should be reduced to 15 to 30%, and the dose should be taken uh, with iftar. If the patient is on twice daily NPH or detamir or glargine, the morning dose should be shifted with iftari, and the evening dose which he was taking before Ramzan should be taken to the sehri, and the dose should be reduced by 50%. So the twice daily insulins, if the patient is taking twice daily insulin, the morning dose will be shifted to the with iftari, and the evening dose will be taken to the sehri, and it is reduced by 50%. If the patient is taking short acting insulins, the dose should be kept same at iftari time. Lunchtime dose should be omitted, and sehri dose should be reduced by 25 to 50%. And this is a scale by which we can control day-to-day blood sugar levels on the basis of blood glucose. The dose of insulin should be adjusted every third day in these patients. For example, if the pre-iftar or pre-sehri blood glucose is more than 200 milligram, the basal insulin should be increased by 4 units. And if the post-iftar and post-sehri sugar is more than 200, the short-acting insulin, which is administered before sehri or before iftari, should be increased by 4 units. So if the post-iftari sugar is raised, the short-acting insulin, which is administered before iftari, should be increased accordingly, according to the blood sugar levels. It is, for example, if it is between 130 and 200, the dose should be increased by 2 units. And if the fasting insulins are increased, fasting insulin pre-sehri or pre-iftari, the dose of basal insulin is increased. Pre-mixed insulins, which are being used more frequently nowadays in our country, 70-30 or 70-25 or 50-50. If the patient is taking once daily dosing, the dose should be taken to the iftari. Dose should be kept fixed. If the patient is taking twice daily dose, again the dose which he was taking in the morning time should be shifted to the iftari, and the dose which he was taking at the night time should be shifted to sehri, but it is reduced by 25 to 50%. If the patient is taking 3 time daily dosing of pre-mixed insulin, the afternoon dose should be omitted, and the seri and iftari doses should be adjusted accordingly according to the scale. For example, if the sugar is checked before seri and iftari, for example, if the sugar before, um, for example, iftari is above 200, the insulin which he's taking at the seri time, it should be increased by 4 units. And if the sugar is at the seri is more than 200, the dose should be increased, which he's taking before iftari. So adults with type 1 diabetes who insist on fasting should be aware of all the associated risks and should be under close medical supervision. They should frequently monitor their blood glucose levels throughout the day. Adolescents with type 1 diabetes who decide to fast and their parents must be aware of all potential risks associated with Ramadan fasting. So patients with type 1 diabetes, if they insist to fast, they should check their blood sugar levels more frequently as compared to the patients with type 2 diabetes. The 7-point SMBG is recommended to these patients. So individualization of treatment option is the proper approach for management of diabetes during Ramadan. Pre-Ramadan patient assessment should include medication adjustment, including the choice of the drug, the timing, as well as the dose during Ramadan. Adults with type 1 diabetes or type 2 diabetes treated with multiple doses of insulin who insist on fasting should be aware of all the associated risks and should be under close medical supervision. Now, this was the source of this presentation, Diabetes and Ramzan Practical Guidelines 2021. An update was also issued in 2024. And this guidelines and authors of these guidelines were from these 10 countries, and 2 Pakistani authors were also included for making these guidelines. Summary of oral medication adjustment. The dose of metformin is remain unchanged. If he's taking 1 time metformin, it is to be taken after iftari. If he's taking 3 times metformin dose, the afternoon and evening dose should be combined and taken in iftar. Morning dose should be kept as same. No dose adjustment in acarbose, no dose adjustment in TZDs. Sulfonylureas should be reduced and taken to the iftari as preferably. GLP-1 receptor agonists, their dose should not be changed in Ramadan and can be continued as he was taking pre-Ramadan. DPP-4 inhibitors do not require dose adjustments. Sulfonylureas, we have discussed that morning dose should be taken at iftar and BD dose should be reduced to morning dose, or the seri dose can be reduced. No dose adjustment or modification is needed in the SGLT2 inhibitors, but the SGLT2 inhibitors should not be started 1 month before Ramadan, and SGLT2 inhibitors should be taken at iftar time. What else we can do in Ramadan? We can ask the patients to quit smoking in Ramadan because it is a golden opportunity. Smoking and during the time they're keeping fast, so they can quit smoking if they want to. So this was all about diabetes management in Ramadan. Now over to the panel for further discussion. Thank you very much.
Thank you so much, Dr. Meet Saab. If any question from the audience, excellent. जहाँ तक मुझे एक समरी सी ट्रीटमेंट में समझ आई है, आपने कहा कि जो इवनिंग वाली डोज होती है उसको सहरी में कर दिया जाए और जो सहरी वाली डोज है उसको इफ्तारी में कर दिया जाए, ऐसे ही है?
सर ये सिर्फ इंसुलिन के बारे में
इंसुलिन
की
इंसुलिन वाली। अच्छा,
जी
और
एक्चुअली
बाकी जो मेटफॉर्मिन है उसकी डोज भी कम नहीं करनी,
जी
और उसको जिस तरीके से आप लेते हैं वैसे ही सहरी के साथ कर, अफ्तारी के साथ कर लें।
जी बिल्कुल ऐसे ही।
बहुत अच्छा मैसेज जाएगा, क्योंकि बहुत इंपॉर्टेंट है ये। बड़े वरीड होते हैं लोग कि जी हम डोज किस तरह करें, क्या करें, कैसे करें। एनी क्वेश्चन? अयूब साहब, कैसे हैं आप अयूब साहब, प्रोफेसर अयूब साहब?
अल्हम्दुलिल्लाह सर, ठीक हूँ, शुक्र है अल्लाह ताला का।
सर, एनी एनी कमेंट सर?
सर, मैं ये कहता हूँ कि रमज़ान शरीफ में इंसुलिन अगर आप खा रहे हैं या कोई एंटी डायबिटिक खा रहे हैं तो उसको एडजस्ट करना ज़रूरी है। और ये कहना कि रोज़ा रखें या ना रखें वो एक अलग चीज़ है। नॉर्मली रोज़ा रखें, अपने अपनी एंटी डायबिटिक ट्रीटमेंट को ठीक रखें, यही फिजियोलॉजी कहती है।
जी, प्रोफेसर अनिका, प्रोफेसर अनिका शायद।
जी सर, अस्सलाम वालेकुम। इट्स
जी
वेरी
मैडम,
नाइस।
कमेंट्स?
सर बहुत अच्छी लगी मुझे ये इनकी टॉक। और ये बात है कि अपनी डोज एडजस्टमेंट करें और अपने रमज़ान को भरपूर तरीके से एंजॉय करके रोज़े रखें दवाई के साथ।
की
जी,
कर लें, टाइम को
बिल्कुल
एडजस्टमेंट कर लें, बिल्कुल
बिल्कुल
बिल्कुल।
ऐसे।
वैसे भी मेरा ख्याल है कि इसके अंदर इंसान की वैसे भी आदत पड़ जाती है। और प्रोफेसर राना अख्तर, प्रोफेसर ऑफ पैथोलॉजी,
अस्सलाम
एफ
वालेकुम। अस्सलाम वालेकुम
जी
सर।
जी, प्रोफेसर राना कैसे हैं आप?
हाँ, अल्हम्दुलिल्लाह सर, अल्लाह का शुक्र। बहुत अच्छी सर प्रेजेंटेशन थी, वेरी इंफॉर्मेटिव डायबिटिक पेशेंट्स के लिए। और ऑलमोस्ट इन एवरी फैमिली देयर आर फ्यू डायबिटिक इंडिविजुअल्स जो कि फास्टिंग भी करना चाहते हैं और रोज़ा छोड़ना भी नहीं चाहते, तो उनके लिए बड़ी इंफॉर्मेटिव थी। थैंक यू फॉर सच अ नाइस प्रेजेंटेशन सर।
डॉक्टर सैफुल्ला, सैफुल्ला साहब। जी, डॉक्टर खतीजा, प्रोफेसर शर्मा कुंदी, ओवर टू यू।
जी सर, अस्सलाम वालेकुम। डॉक्टर सैफ
जी जी, डॉक्टर सैफुल्ला।
जी सर, वेरी नाइस एंड वेरी इंफॉर्मेटिव प्रेजेंटेशन, अल्हम्दुलिल्लाह। और बस यही है कि सल्फोनाइल यूरिया के अलावा जो सल्फोनाइल यूरिया में मुझे ये लगता है कि उनको ज़्यादा केयर की ज़रूरत है। बाकी तो अल्हम्दुलिल्लाह अगर डोज एडजस्टमेंट कर दी
हाँ,
जाए
उसी को
तो
सल्फोनाइल
इट्स
यूरिया
गुड
का
फॉर
इन्होंने
द
बड़ा
बाप
डिटेल में
जी।
बताया, बिल्कुल सही
तो
कहा
बहुत
आपने।
अच्छे तरीके से जो है वो रोज़े रख सकते हैं। बाकी साथ में ये कि थोड़ी बहुत अगर फिजिकल एक्टिविटी भी हो तो फिर आई थिंक कि बहुत कामयाबी के साथ रोज़े रखे जा सकते हैं। थैंक यू।
बिल्कुल, जी बिल्कुल बिल्कुल।
Thank you, Mulazim
डॉक्टर
Saab.
खतीजा,
Thank you so
डॉक्टर
much.
खतीजा, डॉक्टर खतीजा, इफ यू यू कैन से समथिंग, डॉक्टर खतीजा। जी प्रोफेसर, मैं ओवर टू
जी
यू।
सर।
जी जी, डॉक्टर खतीजा जी बेटा।
जी सर, मैं बस यही कहूंगी कि ये बड़ा टाइम के अकॉर्डिंगली, अब जैसे रमजान आने वाला था और मेरी मदर भी डायबिटिक है, तो मैं बड़ी थैंकफुल हूँ कि ये टॉपिक आप लोगों ने चूज किया। क्योंकि हम जो बेसिक्स के हैं, मैं फिजियोलॉजी में हूँ, तो इतनी चीजें
जी
हमें
जी, मेरी
ड्रग से रिलेटेड जी नहीं पता होती। सर, थैंक यू फॉर चूजिंग दिस टॉपिक, और इट वाज वेरी हेल्पफुल अपने पेरेंट्स को बताने के लिए और बाकी लोगों को गाइड करने के लिए इन
बाकियों को भी
रमजान।
बताने के लिए कि जी देखें जी, डोज की एडजस्टमेंट बड़ी इंपॉर्टेंट होती है, इंसुलिन की या दूसरों की। खासतौर पे इंसुलिन बड़ा इंपॉर्टेंट होता है कि हाइपोग्लाइसीमिया में जाने के लिए बहुत बहुत इंपॉर्टेंट होता है। तो उसकी डोज
जी
एडजस्टमेंट करना,
जी
टाइमिंग एडजस्ट करना, डॉक्टर मीर ने बड़ा खूबसूरती से बताया। ओवर टू यू
जी
प्रोफेसर
सर।
शर्मा टू कंक्लूड टुडे सेशन।
Uh, Thank you, Dr. Mulazim Saab. Thank you so much. Dr. Mir Jalaluddin, it was a lovely webinar. अल्लाह आपको इसका अज्र खैर दे। आपने अपना संडे भी ज़ाया किया और इन पार्टिसिपेंट्स ने भी संडे हमें दिया। अल्लाह आप सबको इसका अज्र खैर दे और सब डायबिटिक्स को अल्लाह सेहत दे। आपने जो पढ़ाया है अल्लाह इस इल्म को और भी डिसमिनेट करवाए ताकि सब लोग इससे इस्तेफादा हासिल करें। तो जस्ट कमेंट डॉक्टर मीर जलालुद्दीन साहब, मैं खुद भी डायबिटिक हूँ।
लास्ट कमेंट मैडम, जैसे कह रहे हैं आप एक एक 50 सेकंड में यानी 30 सेकंड में क्या मैसेज देंगे?
सर, दो तरह के पेशेंट्स हमारे पास आते हैं। एक वो पेशेंट्स होते हैं जो हर सूरत रोज़ा रखना चाहते हैं, वो हाई रिस्क कैटेगरी में आते हैं, वो हर सूरत रोज़ा रखना चाहते हैं। हम उन्हें रोकेंगे भी तो वो फिर भी रोज़ा रखेंगे। उनके डिसीजन को हम एहतराम देते हैं, रोज़े रखते हैं, लेकिन फ्रीक्वेंट मॉनिटरिंग ऑफ ब्लड ग्लूकोज लेवल्स इज़ वेरी इंपॉर्टेंट इन दीज पेशेंट्स। और दूसरा ये कि वो पेशेंट्स, कुछ ऐसे पेशेंट्स आते हैं जो आपके मुंह से कहलवाना चाहते हैं कि आप हमें कहते हैं कि बस रोज़ा ना रखें। तो इस वक्त जी,
वो
तो इस
इल्जाम
वक्त
डॉक्टर को देना चाहते हैं, अल्लाह
जी जी
क्या कि
बिल्कुल,
डॉक्टर ने कहा था, मना किया था।
जी बिल्कुल ऐसे ही है। तो वो बार जो है वो हमारे ऊपर आता है, क्योंकि
हाँ।
उलमा ने कहा होता है कि जैसे डॉक्टर कहेगा वैसे करना है। तो किन पेशेंट्स को रोजा रोकना है ये भी आपके ऊपर आता है, और किन पेशेंट्स को रोजा रखवाना है वो भी आपके ऊपर आता है।
बहुत
तो रिस्क,
रिस्पॉन्सिबिलिटी,
जी,
बहुत बड़ी
सर्टिफिकेशन
रिस्पॉन्सिबिलिटी।
इम्पोर्टेंट है। किन पेशेंट्स को आप सेफली रोजा रखवा सकते हैं, और जिनको रखवा रहे हैं उनको फ्रीक्वेंट मॉनिटरिंग और डॉक्टर से राब्ते में रहने का जरूर कहना है। तो
अब तो वो
रमजान
रेगुलर मॉनिटरिंग आ गई, यहाँ पे वो लगा लें और आपको रेगुलर
बिल्कुल
मॉनिटरिंग करते हैं।
कंटिन्यूस मॉनिटरिंग होती है।
हाँ।
तो
और
डॉक्टर के साथ राब्ते में रहें और रोजा सेफली रखें, अच्छा खाना पीना खाएं, डोज एडजस्टमेंट जरूर करना। क्यों?
प्रोफेसर साहब,
थैंक यू जी मीर जलालुद्दीन साहब। मैं बेसिकली ये समझ रही हूँ कि सुबह उसके बाद सहरी के बाद अगर हम प्री सहरी एंड पोस्ट सहरी ब्लड शुगर लेवल ले लें तो पहले एक दो दिनों में हमें अंदाजा हो जाएगा हम किस तरफ जा रहे हैं। फिर
जी
चाहे
बिल्कुल,
सुबह की हम डोज कम कर दें या ज्यादा कर दें। इसी
जी
तरह रात को प्री इफ्तारी एंड पोस्ट इफ्तारी अगर हम देख लें तो रात की डोज एडजस्टमेंट भी, जो कि नए नए डायबिटिक्स बने हैं जो सिर्फ इनिशियल ड्रग थेरेपी पे हैं, तो आई थिंक ये 4 वक्त हमें देखना कुछ अच्छा होगा। और
जी
एक्सरसाइज के हवाले से जस्ट क्वेश्चन, यार अगर हम सुबह सवेरे एक्सरसाइज कर लें लाइक पोस्ट सेरी, तो मेरे ख्याल में वो ठीक नहीं होगा, बाद में हाइपोग्लाइसीमिया में जाने का अंदेशा होगा, इसलिए उसको इफ्तारी से पहले नहीं करना चाहिए मीर
जी
जलालुद्दीन
सबसे
साहब, ताकि
जी
अगर
सबसे अगर तो रमजान में ऐसा है कि अगर तो तरावी पढ़ रहे हैं तो वो आपकी तरावी जो है वो रमजान की एक्सरसाइज में शामिल हो जाती है, आपको एक्स्ट्रा एक्सरसाइज करने की जरूरत नहीं होती। लेकिन फिर भी अगर आप एक्स्ट्रा एक्सरसाइज करना चाहते हैं इफ्तारी से पहले।
ताकि रोजा तोड़ने की जरूरत ना पड़े ना, वो उसी में फिर एकदम इफ्तारी आ जाए। ठीक है, थैंक यू सो
जी
वेरी
जी,
मच डॉक्टर मीर जलालुद्दीन साहब, इट वाज ब्यूटीफुल, इट वाज वंडरफुल।
थैंक यू।
और ये अपलोड हो जाएगा, हमारे सारे स्टूडेंट्स भी सुनेंगे एंड हु एवर वांट्स टू बी अ पार्ट ऑफ इट, प्लीज अपने ईमेल एड्रेसेस छोड़ दें ताकि सर्टिफिकेट आपको डिसमिनेट हो जाए मंडे को इंशाल्लाह। थैंक यू जी, पाकिस्तान
थैंक यू सो
जिंदाबाद।
मच फॉर गिविंग द टाइम प्रोफेसर मीर जलाल और सब लोग। आज संडे बैठा है, आप पर इम्पोर्टेंट टॉपिक। प्रोफेसर सलमा कुंदी, थैंक यू सो मच फॉर सेलेक्टिंग वेरी इंपॉर्टेंट टॉपिक बिफोर स्टार्टिंग ऑफ दिस रमजान। थैंक यू सो मच। इंशाल्लाह सी यू नेक्स्ट वीक इंशाल्लाह। अस्सलाम वालेकुम।
अल्हम्दुलिल्लाह, अल्लाह हाफिज, अल्लाह हाफिज।